Hi, I'm David Gottenborg, Gottenborg Chiropractic here in Pelican Rapids, and today what I thought we'd talk a little bit about is one of the more common things we see is people with varying degrees of arthritis, whether it's in a joint or neck and back. So the question is can we help people with arthritis? The answer to the question is yes, and so really before I can answer that question, I want you to understand what a healthy vertebrae looks like. We'll look at a couple examples of unhealthy vertebrae, but in this case we have two opposing vertebrae with a very healthy disc space. As chiropractors, we're concerned not only about the position of one vertebrae as it relates to the one below and above, but we're also concerned about its movement. Now, things that could affect movement might be tight muscles. The problem may be more long-standing, involving other connective tissue like ligaments. And then what chiropractors are very good at is correcting alignment. How does one position, one vertebrae sit compared to the one above or below? What are some factors that can predispose one to arthritis? Well, there are things like genetic or family history. Another common cause would be injury or your lifestyle. What do you do every day, or things that we do repetitively that just over time cause a wear and tear effect. So there's a lot of different causes, but we believe that with appropriate care, we can do things to not only slow, but in some instances, reverse some of those early degenerative changes. So if this represents a healthy segment, this would be a representation of early degenerative changes. The cushion, the disc, has begun to thin. And in this case, this is more advanced, where the body now is beginning to form bony bridges or bone spurs to fuse the two vertebrae. In the example right behind me, we can see a textbook normal cervical spine, neck, and we can see as the progression to something that is completely unhealthy, where the vertebrae have fused one to the other. Now, up until this point, I really haven't talked about what we do. I can tell you that medically, the treatment has always involved rest, elevation, and medication. With good chiropractic care, where we emphasize on restoring not only position and motion, we can do things to slow or stop the progression, and in some cases, reverse the progression. We want to get the vertebrae moving freely, just like the knee. Once the knee becomes stiff and doesn't move well, the arthritis accelerates. We want to stop the acceleration process. In addition, you can do things that feed the joint nutritionally, glucosamine or supplements that support connective tissue. We want to keep people moving. That keeps the joint and cartilage healthy. Sometimes we might recommend things like a teeter swing or traction. Closing, I just want to say that if we simply excluded every patient with arthritis, we wouldn't have very many people to treat. So there is hope, there is a chance for improvement virtually at any and every condition. In closing, I just want to thank you, and remember, we're in the apple season. Eat apples.
Thank you for watching Wellness for Life.